Understanding your community demands that you interact with people in the community, and so you appreciate the problems that they have.
There is a spirit in the hospital always to give back to the community.
And that spirit has led Hospital for Special Surgery to partner with other institutions, allowing New Yorkers access to its world-class care. The Pediatric Outreach Program, or POP, was founded in 1987 by Dr. Leon Root. Its mission? To bring medical care to underserved school children in New York City.
It hurts your back, huh?
Since it began, 24,000 children have been seen by Dr. Root and his team.
It was quite obvious to me very early in my career that we were missing children's early problems, and we would be seeing children in our hospital clinics, in the office, that had problems that could have been averted if they were seen earlier. When we do find something wrong, one of the really unique features of this program is that we do the follow-up.
This kid pushed me and I fell on my arm.
But working with children gives me an extra pleasure, a special pleasure that touches my heart when I can see the child improve and help them in any way.
We have always felt a responsibility to care for those who have served our country in the military. And so we have been at the Bronx Veterans Administration Hospital for over 60 years.
Since the start of the Iraq War, thousands of National Guardsmen have been called to active duty. Rito Arroyo, a 28-year-old veteran, was no exception. Assigned to a logistical unit in Iraq, the 48-year-old was injured, loading troop equipment onto trucks.
I first met Rito in the early part of 2008. He had been complaining of shoulder pain for a total of about 3 years.
From that, put my shirt on. Every time I pick up my arm, it would hurt.
I really thought it was his pain was coming from his biceps tendon. Typically, it's an overuse injury, and honestly, the biceps tendon is kind of like your appendix. It really doesn't have any function, and ultimately, he underwent a biceps tenodesis to move his biceps tendon out of his shoulder joint a little bit farther down his humerus. He finally achieved pain relief, and so for him, after years of pain, he was extremely happy to be getting his function back and get back to his active life.
While on active duty protecting the Indian Point nuclear power plant, 21-year-old National Guardsman Joseph Four tore his ACL while playing basketball.
I actually jumped kind of high and I came down the wrong way, and it was an excruciating pain. So I ended up coming here to the VA hospital that night so that they could check me out.
Joseph left that night on crutches and spent months in physical therapy. He returned to the Bronx VA 7 months later for surgery.
We had a long discussion with him and elected to proceed with the ACL reconstruction with the patellar autograft. So we used his patellar tendon to reconstruct his ACL.
I'm going to go to California for a year to help train troops that are going overseas, and then I'm going to go to Afghanistan in March of 2010.
We now have at New York Hospital what we call the Medical Orthopedic Trauma Service. And it's a unique collaboration between medicine and the Orthopedic Trauma Service. Anytime there's a trauma alert at New York Hospital, one of our orthopedic residents is part of the original team that evaluates the patient.
Our next story is one that seems to defy medicine and logic.
Two men plunged 47 stories to the ground. They were window washers, also brothers. Now, unbelievably, one of them actually survived.
The window washer who fell 47 stories in Manhattan last month is now awake. Doctors say that 37-year-old Alcides Moreno should actually be able to walk again.
It was a normal day. It was a Friday. I took the kids to school. He went to work with his brother. I was at work in the middle of court when I received the phone call from his friend telling me that they had suffered an accident and my brother-in-law passed away, but that he was still alive. I went a little hysterical, of course, and I had a friend of mine pick up the kids.
Mr. Moreno obviously came in with a multiplicity of injuries, and for a long time it was uncertain as to whether he would survive. He was being treated by a team of physicians based on his abdominal and head injuries. So we took our turn, we worked together. We started putting external fixators on that day. We then began to re-clean the wounds with general surgery at the same time they were operating. We'd have several teams working on Mr. Moreno simultaneously. He had a reconstruction of his knee, which was badly smashed with plates and screws, etc., to stabilize it and bone graft. He had a reconstruction of his ankle, which was badly crushed and had to be put together with appropriate orthopedic implants. He had a ring external stabilizing fixator for his knee where he had multiple ligament injuries, and he had a fixation for his elbow where he had a fracture of the lateral side.
The first 2 weeks, I was pretty much told not to have my hopes up. And then I said, wait, you're telling me not to have my hopes up, but he's working on his leg and he's working on, he just never gave up.
We had to be careful that we didn't do too much too quickly that he couldn't tolerate. He could only take a certain number of hours in the OR safely.
He had several surgeries, over 18 surgeries during the first few weeks.
Nobody believed he would survive. It was a really tough decision along the way as he slowly continued to survive and improve, how far we should go and how quickly.
I thought he was going to lose his leg. Going from losing your leg to being able to walk.
And I think that in his case, having come into the New York Hospital emergency room, where there is a coordination of emergency room physicians trained to deal with trauma, and the orthopedic trauma service, which is physically there in the building, and the trauma surgeons from the general surgical department, all within beck and call, I think is vital. Whether you thought he was going to survive or not, you still did something.
Dr. Lighting, he did the fixes. I mean, most part of my bones. Look at me, still walking.
World-class care for all New Yorkers. The caring spirit of Hospital for Special Surgery.